My name is Alex Bagley, and I'm a graduate student in Sangeeta Bhatia's lab at MIT and the Koch Institute. Cancer is one of the major healthcare challenges for the 21st century. What we're appreciating now is that cancer is a very complex disease, but despite the complexity of this disease, there are some common features that are shared by tumors from many different tissues of origin and many different genetic backgrounds. One of these common features is that they will recruit blood vessels in order to grow. So these highways, which are providing nutrients and oxygen, are important because they also are what carry the drugs that we deliver to tumors as well. And our lab is interested in using nanomaterials to help improve the delivery of drugs through these blood vessels into the tumor. So the nanoparticles that our lab uses are called gold nanorods. These particles are 40 nanometers long by 10 nanometers across. To give you a sense of the scale, if you lined up these nanorods end to end, you could fit about 1,000 across the width of a single human hair. So this image provides a direct window into a living tumor environment. We can see the green dye, which is our drug surrogate in this case, winds its way through the long and winding channels of the blood vessel. And then outside of the blood vessel, you can see these little yellow-white dots, which are the gold nanorods resident within the tissue. Once the nanorods are within the tumor, we can expose this tumor to the right wavelength of near-infrared light. And when the light penetrates into the tumor and it arrives at the nanorods, these nanorods act as little antennas, which can convert this light into heat locally. This localized heating makes it easier for the drug to escape from the blood vessels into the tumor. When we administer chemotherapies to patients, oftentimes less than 1% of that drug ever sees the tumor that it's trying to treat. And the drug goes everywhere else in the body, and it causes all of those terrible side effects that happen with chemotherapy. So part of our motivation for this work is to figure out ways to make the delivery of chemotherapies into tumors more efficient. If we can get 2% or 5% or even 10% more of the drug into the tumors, then that means that's that much less drug that would be wreaking havoc on other parts of your body. Well, I think like many people, I have seen family and friends suffer from the disease of cancer. And as a future physician, I'm actually looking forward to having the opportunity to help care for these patients and help work with their families at the individual patient level. But I'm also motivated and driven to help address some of these problems more broadly through my research. And my educational background is in engineering, biology, and medicine. So this work seemed like a very natural way to blend those interests in a way that eventually help improve cancer therapy in the future.